Welcome back. You're listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And I worked on an article yesterday, and I thought it was kind of relevant, so I thought I'd make that our topic today. I was talking about both physical normality or normal physical function versus optimal physical function, as well as physical reality. I mean, our perception is an interesting area that we can get into, and I kind of dipped into it just a little bit in the article and then said I'll talk about it next time, just as a tease. But so first of all, let's just talk about the approach that we take at A Path to Wellness.
Who are you?
Oh, that's right. Who am I?
Good morning.
I'm Dr. Christopher Jackson.
Actually, good afternoon.
Dr. Christopher Jackson, PhD, DOM, Florida. And I have a practice by the same name as the show, A Path to Wellness. And it's based on the philosophy that I have about people being on a path to wellness. There's not one path, it's individualized. And that's the approach that I take. It's individualized, customized to the individual and their needs. And each person needs different things. We each have our needs everywhere and always in life, right? We have our own specific needs that we have. And when it comes to health and wellness, we each have our own needs, and if they don't get addressed appropriately, we end up with issues, and there can be many health issues that can crop up, and they can catch you by surprise. And when I look at health and wellness, I look at more of a continuity in terms of the history of somebody's treatment of themselves. Athletes really work hard to develop a certain kind of fitness, a certain level of fitness, and yet they may be missing some things. To be optimal is to be addressing all of those needs that we have, and I'm talking optimal in the physical realm now, by figuring out what they are, and that's part of how I approach things, is to figure out what those needs are. So I do this through testing, various kinds of lab work, including blood work, but that's not the only way. Saliva testing, there's other kinds of testing that we can do, hair analysis and so on, that allow us to look inside more deeply at what's going on inside the body. And looking for malfunctions within the realm of the metabolism is one area that I delve into. But other areas, obviously, including hormonal issues, are important to my practice. I look at the balance of hormones and how those are doing. Then I also look at nutritional issues and diet. And, if somebody's eating the standard American diet, we call it that, I don't know why, but we call it the standard American diet because most of the population anyway is eating, I hesitate to call it food, but anyway, they're eating fast food in a lot of cases. And the nutrients just aren't there. Plus, certain components of that kind of diet are inflammatory. So if you end up with inflammatory disorders, you can kind of trace it back to your diet. That's certainly a big influence. And when treating inflammatory disorders, one of the approaches that I take is that I include really, is to address diet and look at, okay, what is their diet? How are they eating? And what components of that diet could be contributing to the inflammation that's present in their body. And most chronic disorders, modern chronic disorders, are inflammatory. So that can be a very crucial part of turning somebody around. For example, I have a gentleman who came in to me with pretty severe gout, and they wanted to put him on all sorts of drugs for it. And, we started right away changing his diet. In fact, he was good with the idea of going full tilt and really making big changes in his diet. And it really sometimes takes that as somebody who's really willing to do what it takes. And we made these very large changes in his diet to where his whole approach in his diet was different now. And it's already much, much better. He's doing much, much better. Of course, in addition to that, I've added in some nutraceuticals that help bring down the inflammation, and some nutrition specifically that, certain vitamins and minerals that he was deficient in after testing. And by addressing all of these issues, we've turned it around quite a bit. And he's lost a lot of weight as well. That's helped him out too. So getting to the root of things, looking at the root underlying issues, the root cause, I can help individuals turn things around dramatically. And, I see it time and time again. So we have this perception, though, of what is normal physiologically, normal physical function. And I'll jump back to the hormones first. I talk about hormones a lot, but with women's hormones, I wrote an article a couple of months ago on women's hormones and how our society basically tosses women's issues around from mouth to mouth. It's basically one woman tells the other woman, oh yeah, I went through that, or my aunt or my cousin or my daughter went through that, or whatever. And it's just viewed in the realm of, oh, that's normal. But fact is, all of the female issues that are common are not normal. They're just common. What is normal, or optimal is the way I look at it, is to have cycles that are not painful, have no or little cramping, at least, no or little bloating, no acne, preferably, or very minimal, all of these kinds of things. So, and if we're talking about menopause, the menopausal signs and symptoms are indications or signs of hormonal imbalance. The same thing is true for menstruating women that have PMS. They may have moodiness, irritability. There may be issues of depression and teariness, along with cramping, bloating, perhaps a heavy flow, or these kinds of things, acne. Many issues can arise in there. Sometimes people will even associate, that time of the month with weakness, fatigue. Well, that's not normal. Those things aren't normal. And if they're not being addressed, that means that an underlying issue is not being addressed. Unfortunately, quite often, whatever testing may be done in the office of the conventionally trained, physician may not be adequate. It may not be deep enough. They may actually deny the patient the testing that would actually get them somewhere in terms of understanding what's going on. For example, I have many women tell me they go to see a certain physician and, somebody they've been seeing, and then they request to have their hormones tested, and they're told, no, I'm not going to test your hormones. There's no reason to test your hormones. I would only test your hormones if you were pregnant, or if, things like that. But in actuality, what they're experiencing is a hormonal imbalance. And even the gynecologists tend not to test for those issues. And that can be problematic because people slide through the cracks. They have these issues that they carry around with them for years, decades, that evolve into further issues, go deeper into more dysfunction. And then when they're already set up this way, with unbalanced hormones, an imbalance that is kind of there foundationally, and then other things arise, stressors in their lives and so on, that really throws a wrench into things. Diabetes, other issues come along, and the hormones already set them out of the normal realm, and then these other issues exacerbate or are exacerbated by those dysfunctions. So it's really important to address things either when they're happening or even before they happen. Preventative approaches, looking at where things might be starting to go in the wrong direction, really tracking these kinds of things. And, in our current structure and society and system of medicine in West and especially in the United States, we have this focus on insurance and, not ordering tests that the insurance companies won't like you ordering because, they won't want to pay for it, and you'll have a battle, or the patient may end up with extra costs on their bill. And I try to look out for those things as well. And what I do is I try to put enough information there to show the justification for what I'm doing when I'm doing a requisition. But the fact is that our system is broken. And, the things that will fix the system are looking at things partly from a different angle, a different point of view. It's not about the revolving door, okay, what's going on? Okay, here's your prescription. See you next time. It's about really understanding the underlying issues, getting to those root causes, and bringing those into the realm of optimal, at least normal, but optimal function preferably. And that takes some testing. It takes some changing of some things. May involve a change in lifestyle. It may involve nutraceuticals, the use of nutraceuticals to fill the gaps. It may involve different kinds of, from my point of view, natural, herbal, or even homeopathic medicines with a focus on addressing specific issues underlying those disorders. And when I say, or even homeopathic, what I'm referring to there, the reason I say it that way is that I'm not looking at this from the classical homeopathic point of view. For me, my preference is to use more complex, more multi-component homeopathic solutions that have been developed, in a sense, from a biochemical or a biomedical point of view. And that's complicated in terms of the explanation, but what I'm trying to say is that there's a kind of homeopathy. It's called classical homeopathy. Classical homeopathy is based on basically a set of signs and symptoms, and based on the combination or syndrome of those signs and symptoms, some specific remedy is chosen, and then that's supposed to address all those issues, and often it does. But from the point of view of, and I have lots of examples, by the way, of classical homeopathy working very well. For example, I have a young lady who has cramps in her legs quite often, and she'll use Magphos, which is magnesium and phosphorus at a homeopathic level. And that helps to get rid of those muscle cramps in her legs. And, you know, essentially what it is it's rebalancing the electrolytes in that case. And there are other similar ideas, and the principles behind homeopathy are treating like with like and this kind of thing. So whatever produces the signs and symptoms that somebody has experienced, you treat them with. So you can use a solution that would by itself in a normal individual who doesn't have these signs and symptoms would produce those signs and symptoms. That's what you use to treat somebody who has the signs and symptoms. That's kind of the principle of it. But with the more complex homeopathic solutions I'm referring to, the approach is simply to get the levels of the specific chemicals, specific messengers that are normally used by the body, get the levels into a realm where the cells will see them and accept them in. If you get it too high a level, the cells won't take it in. If you get it too high a concentration or too low a concentration, the cells won't take them in. But if it's in the right realm, then the cells will take those chemicals or messengers into the cells. And it's a more direct way of really getting some control, and I hate to use that word, but some control over the actual signaling within the body, and to start to teach the body, this is the direction you want to go. And the difference between that approach and the biomedical approach, or the biochemical biomedical approach, the pharmaceutical approach, that is that these substances are already broken down to a level where they can easily be accepted by the cells. Whereas the biomedical pharmaceutical approach is to give you a dosage of a drug that then has to be a very high dosage relative to what I'm talking about homeopathically, that has to be broken down through your liver, your kidneys, and other channels to get to a level where the cells can now take them in. But all of that breaking down by your body's organs causes damage to those organs quite often in the process. Whereas with homeopathic approaches, the same chemicals may be used, or the same substances may be used, but the breaking down is already done for you. So your organs are not subjected to the damaging pharmacokinetics and dynamics that are involved in those organs doing their jobs of breaking those substances down in the biomedical approach or the pharmaceutical approach. So the vast majority of homeopathic solutions have no side effects. No side effects. because that breaking down is already there. So the realm of homeopathy is an interesting one, and we can directly address some of the molecules that are present in the body to, say, autoimmune disorders where there may be an imbalance of T helper cells or an imbalance of cytokines, leukotrienes, that can be addressed directly through homeopathic solutions that have those exact same substances in them. And we can address that directly and alter that imbalance and therefore more directly fight the autoimmune response. So when I'm talking about optimal function and normal function and that kind of thing, and physical function, I'm talking about the realm of bringing somebody back to normality or basically reversing the immune response that is a result of an autoimmune situation. An autoimmune response can be addressed and turned around. And I have been seeing some results in these areas, where I see, for example, antibody levels that were very high come down, way down, these kinds of things. And I use somewhat different approaches in other areas. For example, with kidney function, I'm using herbal formulas and along with changes in diet and nutrition and addressing any deficiencies and just several things at one time, homeopathic as well, that address specifically kidney function, and turning some things around. I have people come in with very low filtration rates on their kidneys, and we see good results, things turning around, and kidney function getting better. And unfortunately, many of these people are being told conventionally that there is no way of doing that, that it can't be reversed, that, once you're there, and, you just have to kind of watch it and maybe use some anti-inflammatories or things like that, which often cause kidney problems too, or use more natural anti-inflammatories, which is at least a better way, like fish oil or omega-3s. But that there's really no way of turning that filtering around. But the fact is, there is. And I've done it many times for many people. So there are ways of bringing normal function back. Have progressed in a very negative way, we can still quite often bring them back from that. Of course, there is some, increased difficulty depending on, how far things have gotten. So if things have been allowed to decay or really build, or, really the dysfunction has continued for long term and things have gone downhill, the more that is the case, the more difficult it can be to turn it around. So again, I prefer to address things when I'm first seeing them. When I start to see issues evolving, then I start to address them so that we can bring people more into optimal function. Like, for example, if I'm starting to see early stage kidney dysfunction, I try to treat that at that stage and bring their filtration rates back up to help them stay away from that realm of dysfunction and stay more in a normal and or optimal range of function. And to me, it's crucial because, again, as we go on in life, we have this cumulative effect that occurs as certain deficiencies are not addressed, and in some cases excesses are not addressed. You know, there's an accumulation of issues that occurs. So we see the result of that accumulation with some eventual major issue that is then faced. So, you know, conventional medicine focuses on treating the symptoms. And because that is the focus, there's really not a lot of additional focus on prevention, and there's not a lot of addressing of the underlying root cause. And so that's more where the kind of medicine that I'm doing is focused. So to go into further examples, like for example, the hormonal imbalance we talked about, and that's not normal, right? So women having all these signs and symptoms is not normal. And what I try to do is reverse that and then bring them more into an optimal range where they're not experiencing all of these signs and symptoms that are so familiar. And, you know, there are so many ways of being so much healthier and you know, better functioning physically. And then we get into the realm of aging. You know, again, the conventional view is, you know, there are certain things that come along with aging, like arthritis and, you know, mental dysfunction, like memory issues. There may be some cognitive issues, brain fog, things like that. Dryness, skin issues in general. You know, skin may be very thin eventually. Muscles may be atrophied, and all of these kinds of things are associated with aging. Yet, no one particular individual has all of these issues at one time. So, you know, it's rare to have anyone have all of these things we associate with aging, you know, simultaneously. So, is it really aging, or is it really allowing these issues to go unaddressed over time, not addressing issues when they start occurring in the body, or even taking steps to prevent those things from occurring? And obviously I lean toward the latter, right? People are not addressing issues because in conventional medicine, again, it's about treating symptoms. So you've got to wait until something shows up and then you can address it. How do you address it? You address it by treating the symptom. But why is that symptom there? Well, that's not really something that's dealt with very much. And an interesting example comes to mind as well of that. So our society is very deficient. The United States population is very deficient in iodine. And that's being documented more and more, and people are starting to understand that that is the case, and the standards that have been established in the United States are ridiculously low. And, you know, like a RDA of, 150 micrograms of iodine. You know, iodine used to be included in the baking process. Not only was it removed from the baking process, but other substances were added into the baking process, such as bromates and bromides, that actually lead to subduing of thyroid function. And, you know, other things come along with that. Iodine is helpful in immune response and addressing many issues that can occur if you're insufficient in iodine. From breast lumps and fibroids, cysts and fibroids, to fibrocystic breast, to issues with the thyroid, to breast cancer, to cervical cancer. Many things are affected by iodine being too low. And unfortunately, our society has been pushing further and further into this deficient state. The great grand solution was to iodize salt. And then the great grand solution to keeping hypertension down and helping with various other issues was, stay off the salt. So you're staying off the salt to avoid those issues. And what is the primary source of iodine? The salt. So salt is not the real solution there. I mean, iodized salt is not the solution. And another facet to that is that even if you're getting iodized salt, the problem is in a lot of the other processes, even where salt is used in the baking process, for example, the manufacturers or bakers are not required to use iodized salt in the baking process. So it's not even there. So you're not getting iodine in that way if you have salt in your food. And the only place it's going to be is in the table salt. Well, that's not a good solution. And there are many other sources of iodine. So it can be anything from green leafies to leafy vegetables to seaweeds of various sorts, from dulse and nori and all of these various kinds of seaweed that can be included in the diet. Now, those who have caught on to the sushi craze, which has become greater in the US, has those individuals who are doing more of that are certainly getting more iodine. But some of the seaweed that's being used, even in those cases, is not the highest in iodine content. So there are other ways of getting your iodine. And there are some drinks now that are out, that have been out for a while, that can be helpful somewhat. Things like Green Goodness, Old House Farms Green Goodness, the naked juices, the naked green juices, things like that. Or you can go to a health food store and have them grind up some of the veggies that have iodine in them, and that can help you out a little bit too. But there are vast discrepancies between the levels of iodine that other populations are getting and the levels in the US. I mean, we're talking like 100-fold. You look at Japan's consumption of iodine, it's up there in the tens, like somewhere between 5 and 50 milligrams per day of iodine, without huge issues. In fact, the incidence of fibrocystic breasts in Japan are minuscule compared to the United States, where it's extreme. It's over half the population. So, you compare that to the average consumption in the United States, which is dismal. It's way below a milligram, So that's an issue. And getting to the root of it, we have to address these issues in the food, obviously, and come up with different standards. These are not good standards. But when addressing these issues for individuals, I do some testing to see, okay, what is their iodine level? Do they have a need for this iodine? Okay, and then what level are they at? You know, how much do we need to help them out? And that is one of the ways that we bring people from what they might be considering normal, but it's not normal. It's way off from normal, more into normal or optimum function. All right, so when we get into the aging realm, though, you know, if these things are being ignored, for example, we go to the incidence of thyroid disorders in women, right? 1 in 12 women by the age of 50 has a thyroid disorder. By the age of 60, it's 1 in 6. And that's accelerating, right? So, you know, get a little older, you're probably seeing more of that. So one of the reasons could be this root of iodine deficiency. There are other reasons as well. For example, there can be other deficiencies like selenium. Selenium is a very important mineral in terms of the conversion of thyroid hormones, specifically from T4 to T3, which is the more active hormone, and specifically even beyond that, free T3, which is the active version versus the total amount of T3. And I'm saying T3, T4. T4 and T3 are tetraiodothyronine. That's the T4, and then triiodothyronine. Another word for the tetra is thyroxine. So, and you may have heard of levothyroxine, right? Synthetic levothyroxine, or Synthroid, right? Synthroid is the kind of Band-Aid approach that is taken conventionally. It's a T4, synthetic T4. And therefore, because of that, quite often what's focused on in terms of testing is testing of T4. But what's the active hormone? It's not T4, it's T3. So if the process is not happening correctly, the breakdown from T4 to T3, then somebody can be getting a lot of Synthroid, pretty significant dosage, and still not seeing changes in their signs and symptoms. And that usually won't be looked at. Let's just put it that way. So, you know, using the Band-Aid, the T4, is not a thorough approach to treating the issues. And looking more to the root, you know, understanding what might not be happening there in terms of the conversion. And then there's not only the conversion of T4 to T3, but then there's the actual assimilation of the iodine and of the thyroid hormone, the actual absorption or the uptake of the thyroid hormone. So if that's not doing well, then you've got to work on, well, why is that? And that can be related to D3 and other issues. So getting to the roots of these issues, we can help to normalize and optimize the function metabolically, and we can go on into other areas as well, but that's another example. So what happens if somebody's thyroid is sluggish and they're elderly to boot? You know, well, you have a complicated situation, right? There may be other things going on that they're deficient, where deficiencies are showing in them physically. And then on top of that, the thyroid issue is affecting their absorption of nutrients that they desperately need because they're already deficient in those areas. And because they're not absorbing them very well, it's just continuing to avalanche. And so addressing the combination of issues is now important, you know, looking at how other things may be going on, and yet their function, not only physically, but mentally may be affected. So, giving them a dose of Aricept to increase their acetylcholine presence, which is a neurotransmitter used in cognition and memory, is helpful. However, it doesn't address necessarily the root cause. And some of this can be nutritional deficiency. For example, acetylcholine is essentially a molecule that is a combination that includes an acetyl radical and choline. Choline is a B vitamin. So if you're deficient in choline, you won't be able to produce enough acetylcholine. So that can affect your cognition. So one of the things is to make sure that they're getting enough choline, right? So that they can do that. And then substances with the acetyl radical, so N-acetylcysteine, for example, that has the acetyl radical in it, can be helpful. So that's just one aspect. There's so many other things that can be involved there that can be addressed to make one's function more normal. And I'm giving out a lot of these little insights, but my intention is not to treat, cure, or prevent anyone right now on the air. What we're trying to do is talk about how things can be different, the approaches that can be different, and how things can be brought back to more normal and or even optimal function. So one of the things that's back to associating things with aging, one of the things that's associated with aging is memory issues, right? And even taking it further, dementia or Alzheimer's. Yet all of these can be improved by addressing the root issues, the underlying cause and or the underlying dysfunctions that are existing, the underlying deficiencies that may be present that either cause or exacerbate the condition. So we can help turn people around. I have a lady, for example, she's in her 70s, who came to me when she first came to us. When she first came to us, she was calling. She called. She found us somehow and called and set up an appointment. Then she called and basically noted that she had this number on her pad, and she was calling to see why she had this number on her pad. Called us up. And then we said, oh, yeah, you spoke to us and we set you up an appointment. Then she called like probably 2-3 times trying to confirm what this appointment was and when it was. And then there were calls about, how to get to the office and these kinds of things. So there was a lot of confusion, a lot of memory problems there, all this kind of thing. She was having a real struggle. But nowadays she's sharp as a tack. She's so on top of things. And again, that's just a matter of getting to the root, figuring out where the deficiencies are, especially, and addressing those issues. And we can address also the approach, the Aricept approach, which is basically it's an acetylcholinesterase inhibitor. What that means is it inhibits the enzyme that eats up the excess acetylcholine once the neurotransmitters have fired or been sent out, right? That have connected or communicated. And there are natural acetylcholinesterase inhibitors, rather than synthetic drugs. And that can be part of the approach. In fact, I think it's a good aspect of that. It's a helpful aspect. But there are also the basic nutrients that you need to create those neurotransmitters. We want to address that as well. So by doing this kind of combination therapy, the lady's functioning much, much better. And this is the kind of thing. This is going from, you know, what is considered normal, and unfortunately it's considered normal to be forgetful. It's considered normal even to in some ways to have dementia in older age, I mean, but that's not normal. That's not how your body would normally function, right? That's the result of certain things not being addressed over time. And therefore these conditions evolve and worsen. So when we talk about sarcoidosis or issues with muscles and fatigue and atrophy and these kinds of things in old age, well, one of the more obvious things to look at is, are they getting enough protein? And what forms of protein are they getting? That's one part. And then, are they absorbing the protein well? Is the body taking it in and using it? Well, again, back to thyroid function. If the thyroid's not working well, they're not going to be able to absorb it properly. That's one aspect of it anyway. And are those aminos that they're getting out of the protein aminos that they need to build their muscles? What about the branched chain amino acids, right? We have several of those that need to be in the proteins that they're consuming. So they can set up the things to allow them to build muscle. And then what about deficiencies in other precursors or nutrients that work with the body to help produce not only the muscle, but the energy involved in that? And some of those can be CoQ10, B vitamins, these kinds of things. So the right combination can help to improve everything. We can be much more normal, more functional, much longer, and live life in a way where we're healthy and thriving late into life. And that's the point of view and the angle that I look at things from, and that's the approach that I'm taking. So we've talked about a range of issues that we deal with, and the normal function versus the optimal function. And I kind of segued earlier into physical reality and that whole concept. So I'm going to go ahead and talk about that a little bit. And this is kind of aside from the medical issues, but just kind of a side note, kind of a different way of thinking. So we talk about physical reality. My question is physical reality? How's that for you? Is physical reality? What is physical? Is physical solid? Hit the table. That's solid, right? Is that really solid? Or, is my body really solid? Are my bones really hard? This is how we perceive things, right? Yet, when we look at them subatomically, we have little gas clouds, basically, we call atoms, for which the majority is space. In other words, the majority of what we are, the majority of everything around us is space. So what makes a table solid and feel solid versus, say, your finger or the tissue on your finger or the palm of your hand? So that realm is into the density of the substances. And even that term substances implies physical, right? But it's really about a differential of density, right? When we look at energy, we've got, and I'm going way, kind of an interesting segue here, but when we look at waves, wave fields, right? We look at energy, we look at electromagnetic energy specifically. We have waves of energy. We have wave fronts. When we have a convergence of waves, we have more energy in one area, and it's more dense. So we have this convergence that creates this density, and as that density is higher than the density of some other field, then it's going to appear more solid than that other field. So the reality of this physicalness that we call physical or solid or whatever is actually electromagnetic. We are all electromagnetic beings, and we are surrounded by electromagnetic fields surrounding our bodies individually, and also tied into greater, larger fields. And we have convergence of fields when we're in the presence of another human being. So we have this connectedness energetically. And how is this important? Well, it's important because when we start recognizing that we all are sharing the same energy and that we are affected by each other's energy, we can pay attention to those situations and those effects and fine-tune our responses, and both our own subconscious responses, our own conscious responses as well, but how we think about those things and those situations and those people, and adjust our way of life to absorb the energy that is positive and to deny access to the energy that's not. So like if you're in the presence of somebody who's a very negative individual, you can simply walk away. You don't have to absorb that energy. They have this negative energy, right? You don't have to absorb it. And negative energy isn't just like a concept, it's real. I mean, I'll give you an example. There are dogs. I mean, this has been for decades now. And I know they were doing this in France originally, where they use certain dogs to sniff out cancer in patients. The dogs can sense the differences in frequency between the cells that are normal and the cells that have cancer, because those molecules are putting out different frequencies. They're aberrant frequencies. And other kinds of inflammatory disorders put out aberrant frequencies. And we can look at negative energy from individuals in the same way. So even Freud talked about energy in individuals, and that dealing with disorders was related to their energy, and they can have energy that sucks, literally sucks your energy, or they can provide energy. They can be helpful to creating good energy. So, and this is one of the things with extroversion versus introversion. An individual who goes to a party and feels drained by the time they're done, seeing a bunch of people and so on, may be an introvert. Whereas somebody who goes to a party and is energized by it and feels great around all the other people and loves it and flourishes in it is obviously more on the lines of extroversion. And so they're getting more of a positive influence from all of the energy of the individuals versus the one that is drained from all that, right? So even us individually, we may be able to handle certain kinds of energy and not handle other kinds of energy. And when we get back to the electromagnetic area, I've treated individuals who had a disorder that's becoming known. I've been treating these people for quite a while. Some of my early patients actually were of this sort. It's called electromagnetic hypersensitivity. People who, when surrounded by electromagnetic fields, are disturbed. They may be disturbed emotionally, mentally, and or physically. They may even be in pain. And there are folks like this. There are even growing societies to help individuals like this. And obviously, we're all energy beings, so we're all being affected. We may not be as aware of the effects as some. So back to the core topic for today, just, normal versus optimal physical function. You can see that we can get into many realms here, and that we are influenced by many things. There were studies back, way back, that showed that diabetes can be caused by exposure to electromagnetics. People who worked in electrical fields throughout their day quite often ended up with diabetes. Specifically electrical workers, people who worked at substations, things like that. And that relates to how those unnatural electromagnetic fields, including digitized waves, same idea, and we are being surrounded by digitized waves nowadays, are abnormal to our bodies. So our bodies go into a stressed state when exposed to those frequencies. And that can affect normal function and take us away from more optimal function. So, many things can be involved in helping individuals to reverse disorders that they may have evolved toward, and to address issues at many levels that could be involved. So things are not as simple as they may seem quite often. Let's just put it that way. So anyway, hopefully that was interesting. You've been listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com.
Doc, before you go, stop. Hey, alarms. Any idea on what we can expect for next week?
Who knows?
Just then,
Yeah.
for everybody to be
I'm
healthy,
trying.
merry and healthy,
I
and
am-
we'll figure out next week.
Trying to work to set up an interview with an individual who's a CEO with a medical marijuana company.
Oh, cool,
That could be next week. I'm just not quite sure yet.
cool.
All right.
So no matter what, it's always very interesting.
Right.
We can assure that.
That's right. I appreciate that. So anyway, if you want to find out more about practice, you can hit the website at www.aptw.net, short for A Path to Wellness. Or you can give us a call at 727-329-9637. Thanks for listening.